Hey everybody, it's Roxanne from Champion of My Heart, and I wanted to run through 5 ways the pandemic has affected your access to veterinary care. Some of these you may know, some you may not. So let's get started here. The first is, in many cases, you may not be able to go inside the veterinary hospital or clinic. And I know it depends on where you are in the country, how bad the cases are, and all that. At our main hospital right now, I could go in if, when my dogs have appointments, you mask and you wash your hands and all that, there are routines. But with the specialist that we've been seeing for our youngest dog's dermatology issue, we've been seeing him for appointments since August, and I've literally never met him. I've not been inside the hospital. I've not met him in person. We just talk on the phone when we're there. So this picture that I'm sharing is from our last recheck appointment, where Mr. Sticks and I were waiting out in the car for them to come get him to take him in for his appointment. So you may or may not still be able to go into the hospital. The second thing, and this is the hardest one, is that you may not be able to be with your pet if they are in a very critical situation or they are there for euthanasia. And trust me when I say that the veterinary teams are struggling with this as much as you are. It's very difficult for them to, either have to limit or completely, say, no, you can't come in for those kinds of appointments. And I know early on in the pandemic, it caught a lot of people off guard. It was very upsetting. They show up with a very sick pet and are told that you can't come in. And it's hard. It's hard for you. It's hard for the staff. But it's to keep people safe. And so be prepared. If that's the case where you live, the hospitals that you use, be prepared maybe for that to continue for a while, even as we head into the second year of the pandemic. Number 3 is that you may only have access to urgent or emergency care, not to routine stuff. And this was much more common early on in the pandemic, where communities had much more stringent lockdowns of the area, and they literally told veterinary practices, yes, you're considered an essential business. However, you should put off all routine stuff and only be dealing with sick, injured, pets, not with routine kinds of stuff. Now that's changed probably in your community as it has in mine. But what happened is there was a backlog then, right? There were many months where people couldn't get routine care, didn't have access to it. And so now there's still a little bit of a backlog, and veterinary practices are having to catch up. So it's going to be tough going still for a while, but just plan ahead, get in when you can, get that routine stuff taken care of. Now this one, number 4, longer than usual wait times to get an appointment. This has a number of potential reasons. The first is that the curbside protocols and other things that veterinary hospitals have in place to handle things during the pandemic, it's slowing them down in a lot of cases. So everything takes longer. And so potentially they're seeing fewer appointments in a day. Maybe not, but in some cases they are. And again, the demand is really high. People are spending a lot more time with their pets, and they're starting to notice things that maybe they wouldn't have noticed wouldn't have noticed in other times when they were busy or not hanging around. And I've heard specifically with dermatology issues that this is the case, that a lot of people are starting to realize just how uncomfortable their pets are, how much they're scratching and licking and chewing and that kind of stuff. So in particular, dermatology appointments can be a long wait. For example, when we started seeing the dermatologist for our youngest dog, Mr. Sticks, I had to wait, I think, 8 weeks to get the first appointment to see the dermatologist. So in the meantime, we saw our main veterinarian, and she gave me some topical things and some advice that we could use while we waited to see the dermatologist. But so that was tough because when you get to the point when you're like, wow, my dog needs to see a specialist, and the wait time is that long, not ideal, but, be patient with that. They're doing the best they can, but plan for longer than usual wait times. And The other thing that may happen if things get really bad is that your veterinary hospital may be forced to close. And again, this is something that was more common early in the pandemic, where health departments were going in and saying, if you have any cases, the risk of spread is really high. And they could early on, and they did, force some veterinary hospitals to shut down. But what the hospitals have done in response to that is they have cohorts of teams that always work together and alternate around. And so the idea around that is, if someone on team A is sick and maybe other people on team A have now been exposed, you can take all of team A into quarantine. They don't work, they don't come in, but teams B, C, and D, I don't know if they would have that many, but the other teams would be able to step in and cover those shifts. So again, that's a little less common now as we head into the second year. But that is the potential if there was a significant outbreak linked to a veterinary facility. Health departments could force them to shut down. So here's how you can help. And again, I've been writing about veterinary medicine for, like 25 plus years now. I spend a lot of time interviewing veterinarians, talking to them. I know how hard they're working. I know what a struggle this is for them, that the strain it is on them. So here's how you can help. Number one, be nice. Veterinary practices and people who work there are suffering an extraordinary amount of verbal abuse from clients who are frustrated and worried and cranky and all that. So I'm here to say, please don't do that, because they're working really hard and they're under a tremendous strain. So, be patient. I know it's hard if there's a long wait time and it's cold or it's hot or whatever it is, you're out in the parking lot and you're waiting. Be nice. Be prepared. And by that, I mean, bring something to entertain yourself if there's a long wait. Write down your medical history stuff that you want them to know. Like I actually type it up and send notes in when I send sticks in to see the dermatologist. Be prepared to, send your credit card number in, to pay, so it's simple or easy. A lot of practices now you can, they send you a link and you can pay online, with your phone. So, be prepared for that. And keep your pets safe, right? The better care we take of our pets now, the less likely they're going to need veterinary care in an urgent way. And that reduces the strain on our veterinary teams and the hospitals currently. So that's our best ideas for veterinary care during the pandemic. If you appreciate this kind of information, I would very much like it if you could subscribe. And as a bonus, we currently have 3 foster puppies in the house. They've been with us for about a week and a half now. They'll go back to the shelter next week for adoption. But as a bonus, this is, we've been calling him Chocula, but we're told that the young man who is going to adopt him has picked out a different name. He is going to call him Archer. So anyway, so this is Archer. This is, come here. Hold on. They're asleep under my desk. We've been calling this one Carmela. Carmela is a tricolor little female, and that was my grandma's name. So she's named after my grandma. So she will also get adopted next week, won't you? Very good baby. And then this one, come here. Oh, hold on. This is Cocoa Pop. Also a little female, just 2 colors, brown and white. She is very sweet. She is the most similar in personality to our eldest Clover, who is the black and white face here on my screen. It's on the left. It might be on the right for you. But so this is little Cocoa Puff, and she is also a very good girl. She's the snuggliest of the 3. After dinner, we cuddle a lot and watch TV and stuff. So bonus foster puppies as promised. Hope you're doing well, staying healthy, staying relatively well supplied. Puppy kisses and all that. I hope you get those sometimes too. And you take care, and we'll talk to you again soon. Thanks so much.